Joining me now is Indiana Governor Mike Braun. Great to see you, Governor. Thanks for being here. The Justice Department says this isn't just a handful of bad actors, that this is, and I'm quoting them here, staggering industrial-sized fraud. That's what they're calling it. Is that an overstatement, or have they got it right?
That much money in relation to your budget, and when this has been such a hot topic for all states, and the issue is, Hurdy was campaigning on doing more of it. Most people in D.C., there are about 3 or 4 of us, Rick Scott, Ron Johnson, we went after this stuff all the time, but you could get no interest in fixing it from the federal level. In these blue states that talk about doing more, zero interest, David, on running it well and efficiently. And then they get into a pickle like this, where they were so derelict, you could never miss that amount of money. So that means they were condoning it minimally, could have been part of it. We'll find out. Ron Johnson said he's going to do some subpoenas through his own committee. I think the federal prosecutors are going to look into it. This is something so large, it's hard to imagine. And it's gone on for that amount of time, which is crazy.
Well, you're in a great position to look at the situation as a governor, and as a governor who's dealt with Medicaid. The Wall Street Journal actually puts you in the absolute opposite corner of where Minnesota is. They have a piece out called A Tale of Two Medicaid States, Minnesota Fraud and Indiana Reform. How did you get it right, at least according to the Wall Street Journal? What are you doing right that Minnesota's not doing?
Well, number one, I ran a business for 37 years. So when
you
come into a job like this, big difference. I mean, these are things that would stand out so blatantly that you'd have to be aware of it. It can't just go unnoticed. We did simple things like we found out many people were on Medicare or had not gotten onto Medicare, still on Medicaid. There's a thing called the 340B pharmacy program, which allows hospitals and pharmacies to buy stuff at a discount. Well, you're supposed to sell it at a discount. They weren't even monitoring that kind of stuff. We caught that immediately, doing a quarterly check to see if you still qualify to be on Medicaid. Because if you're on it and you don't qualify, you're taking it away from the people that need it. A lot of low-hanging fruit, common sense stuff, many other things you can do to actually make sure it's being run well. But my point is, government doesn't have competition. The revenues are given to it at any level. The federal case, I mean, it shows up in $2 trillion a year annual deficits.
That's
you and
right.
I have talked about that a lot.
Right.
In the states, you don't have the printing press. So this stuff should stand out like a sore thumb.
Yeah.
The blue states that are running their operations like the federal government, California, Illinois, New York, Minnesota, have to be held accountable.
You're running your state like a business. They're running it like the jerks inside the Beltway. Forgive me, because I know you were one of them. But the point is that Minnesota's Medicaid spending increased 60% since the pandemic. I mean, billions and billions of dollars more. How much did your Medicaid, during the course of the whole pandemic, the past 6 years, how much has your state's Medicaid spending gone up?
So over the last decade, I did that immediately to track it. It was up 135%,
Ooh.
a lot because they lured states in because they were going to pay for more of it. But it's run so efficiently, even with a better cost share percentage, it's gotten out of hand. It was getting into all kinds of areas like ABA therapy for autism. You know, during COVID, many states did what they couldn't do sustainably once all that money was gone. We immediately started tracking how it went up during COVID under the last administration in Indiana, and then baselined it back to where it should have been with just normal increases. Common sense stuff like that, David. If you put a little bit of accounting, a little bit of rigor to it, you can find all this stuff, and we're getting to every one of them. We're going to save over the next 2 years against projections nearly $1.4 billion in total Medicaid and over $400 million our share in Indiana.
So while Minnesota's spending is going way up, yours is actually coming down. I think the Medicaid enrollment in your state has declined about 11%, correct?
You got it, 12%. And that's because we found out even our own state agencies doing this were advertising to get more people on Medicaid onto a broken system that needed to be completely scrutinized. We're doing all that. And you know who the people are that are going to benefit? The people that it was really designed for.
Yes, exactly.
And unless the feds get this stuff fixed there, Medicare is going broke in 4 years due to the trust fund being depleted. Medicaid is in bad shape as well. Those are programs people need. They're wanted, but they can't be run by the seat of their pants.
And, you know, it's larger than Medicaid, although it's connected to Medicaid, which is Obamacare. Obamacare had that horrible title, the Affordable Care Act. There was nothing affordable about it. It's increased dozens of times since it was inaugurated. And it actually, I think, and I think you'd agree with me, it was never meant to lower costs. What it was meant to do was to hook as many people, as many Americans on government assistance as possible, no matter what the cost. How do we cut the cord of Obamacare before we turn into a socialized country?
It's one of the biggest arguments I have is as someone wanting to reform the system. That's where Republicans need to realize healthcare runs like an unregulated utility, David. There's no transparency, no competition. You got a really weak consumer that has no skin in the game. We need to turn it into, if it's going to run as a market, it needs to be a real market, because our hospital costs, our pharmacy costs, insurance is an unnecessary administrative expense. They take 15 cents out of every healthcare dollar. We've got to fix it. It would be better for Medicaid and Medicare. Most hospitals are getting up to 70% of their revenues through those government programs. The Dems just want more on it, so it ends in a whimper in a one-payer system that will be run poorly, if it's any indication how Medicare and Medicaid is being run now.
You know, you, like me, I think, are fans of Milton Friedman. I know I am. And he always said about healthcare expenses, he said, you want to put as little distance between the provider and the person receiving medical assistance as possible. Now we have so many middlemen in the middle, and that's why President Trump wants to focus on giving the money to the people, letting them spend it. It's their money. Nobody's going to spend it better than they will. Last word, quickly.
One other thing, too, it needs to be based upon prevention and wellness, not expensive remediation, which is the current system.
Governor Mike Braun, it took a businessman to figure all this out. Good to have you here, Governor. Really appreciate it.
You bet.